Hello everyone, this is Yoshiko Yamaguchi from Kwassui Women's University, Japan. I'm so pleased to have an opportunity to present a part of our research in this international conference in webinar. Today, I will talk about work and family-related stress level compared with between nurse and other than nurses. Firstly, I want to address what is work. Work have wide meaning, which is labor, effort, study, and we normally spend a lot of time for work every day. We work for what? The primary one would be gaining money for living independently. However, why we work? The reason is not only for money. We can perceive achievement, fun, pleasure throughout working. For example, if someone be grateful or their state was improved for work which we have done, we feel very happy because we are able to recognize we contribute for others by ourselves. Next, family is important for us, same as work. The word of family has contained broad and complex meaning. However, its simple definition is a group of people related either by consanguinity, by recognized birth or affinity, by marriage or other relationship. The purpose of families is to maintain the well-being of its members and of society in human society. We are grown up in family and learning, caring, and supporting each other in family. We human beings cannot be living alone. We need to be related to significant others such family. Family is important for everyone, therefore we spend a lot of time and effort for family, same as work. Then if we meet the family trouble with a sickness, relation, or financial aspect, we are worried family, then this relates to be made our mental health impede. Both work and family are our foundation and necessary things. Most of the time, other than sleeping time, we spend in work or family with family. So for us, work and family life affect each other. For example, when we failed something in work, then feel depressed. After go home, we feeling not good, then would not want to do family obligation, for example, cooking, cleaning, unwilling to cook, unwilling to cleaning, unwilling to do everything for family members. So, for example, however, contrary, if we success delegated project, we are happy, or very happy, then we can enjoy to do family task after go home. Also, opposite direction exists when we spend happy time. For example, having good relation with partner or children, having good event with their children awarded in a class, for example. So we feel happy in a family. So then we can go to work. Then we will be able to good perform in work more than we are normal feeling time. Regarding negative direction, representative concept is work-family conflict. Work-family conflict is perception of difficulty arise from competing responsibility to work and family. Individuals who are active in both work and family domain experience conflict about the distribution of time and energy for performing each task, which is defined as work-family conflict. Therefore, these perceptions have negative effect to employees, psychological consequence, variables, turnover intention as well, and low mental health status as well. On the other hand, positive direction representative concept is work-family enrichment. Work-family enrichment, which occurs when an individual takes the resource created in one domain and transfers them to the other domain, creating a better environment in both domains. It seems like to integrate both work and family life. Therefore, this perception have positive effect to employees' psychological consequence variables, well-being, good mental health status, and reduced turnover intention. In past study, negative side of work-family interface and work-family related stress concept and concept of work-family conflict, its antecedent or consequence was focused. However, recently, this positive perception work-family enrichment have been focused by researchers. Both work-family conflict and enrichment are predicted by work or family-related variables. Negative perception work-family conflict is predicted by negative work or family stress. High job demand relates to high work-family conflict. Also, high family load stress associated to high work-family conflict. Contrary work-family conflict, work-family enrichment is positive perception of work-family relation. So this is predicted by positive work or family-related variables. High work engagement predict one's high work-family enrichment and also high family support associate to high work-family enrichment. Then leads to work-family perception have opposite impact to work or family status, as I told you previous slide. So negative perception, work-family conflict have negative impact. So if someone's work-family conflict high, then if it continue, high status continues, so he or her mental health impaired, finally decide leaving work. On the other hand, positive perception work-family enrichment have positive influence. If someone feel work-family enrichment, if it continue the status, positive status, so he or her job or family satisfaction high, they feel happy in both domains. These two work-family related perceptions are predicted by work environment, so we suppose the level of work-family conflict and enrichment would be varied among occupations. Among numerous occupations, we especially focused on nurses. Nurses are predominant healthcare workers in the world and delegated to the robust role of maintaining or promoting people's health. So nurses are definitely important occupation to keep people's health status. Therefore, nurses are also required to maintain good health status themselves for fulfilling good performance. However, regrettably, several studies reported that nurses' poor mental health status. Nurses are characterized by the fact that women dominate workforce. Still now, women are often delegated major family tasks more than men, regrettably. So we suppose that nurses' work-family stress level would be higher than the people who work in other than nurses' occupation. Along the mentioned background, we generated following study purpose. The purpose of this study is to explore nurses' work and family-related stress level with comparing between nurses and the employee who work in other than nurses. Data were collected in the Kyushu district of Japan. Regarding nurses' data, we randomly selected hospitals, nursing homes, and home healthcare institutions in Kyushu, in Japan. Then asked them to give the permission conducting the study. Finally, 4 hospitals, 20 nursing homes, and 34 home healthcare institutions have agreed to attend our study. Next, we have tried to select occupation which other than nurses. However, This process was quite difficult because choosing representative occupation seems impossible because numerous occupations exist in our society. Therefore, we applied snowball sampling way to select the company in Kyushu. Finally, two transportation companies, three manufacturing industry, and one insurance company have agreed to join our study. And we analyzed total 707 varied questionnaires. We measured the three group study variables which were the negative direction, positive direction, and stress outcome. Regarding work and family stress variables, negative aspect, so we measured target work-family conflict, work or family load overload with using validated scales. Measuring target work-family conflict by using Japanese version of the multidimensional work-family conflict scale. The original work-family conflict scale is English. Dr. Kwassui, Japanese researcher, has translated them, validated this English scale to Japanese version. Targets both work or family load overload were measured by using abbreviated work and family overload measures which are created by Dr. Russell Matthew. This scale originally in English, so we translated this scale to Japanese after we gained permission from Dr. Matthew. Next is positive direction. We measured targets, work-family enrichment, work engagement, and work-family culture. Measuring target work-family enrichment by using shortened work-family enrichment scale, which is created by Dr. Kakuma. This scale originally in English, so we translated this scale to Japanese after we gained permission from Dr. Kakuma. Target work engagement was measured by applying Japanese version of the Utrecht work engagement scale short version which created by Dr. Shimazu, Japanese researcher. Regarding target work-family culture, we measured the level of belief that the participant organization understood his or her family law. We created one item by ourselves, so this item content is that your organization understand your family law. Response used a 4-point scale. 1 is there is no understanding. 4 is there is understanding. Higher score is high work family culture. As outcome variables, we selected to measure targets intention to leaving work and overall subjective health. We applied independence t-test to compare target nurses and the target who work other than nurses for their positive or negative work-family related stress variables and its outcome. Next is result. Entire target mean age was 40.5 years. In negative aspect, nurses scored significantly higher level of negative stress direction variables than the target who work in other than nurses. In positive aspect, nurses scored significantly lower level of all positive stress direction variables than the target who work in other than nurses. Next is outcome variables. Target nurses indicated significantly higher score of intention to leave work than the target who work in other than nurses. There were no significant difference exist for overall subjective health score. Implication for practice. Ahead of it, this study have limitation, especially selecting occupation of the other than nurses occupation. So we couldn't say that selected the other occupation in the study was represented the other than occupation of nurses. However, this study result indicated that nurses' stress status might be worse than the other occupation. Therefore, it is implied that nurses' work environment would be severe. Nurses is exactly important occupation for our society to keep our health. It is important that the effective implement should be done for their work environment to be better. Thank you for your kind attention. Thank you very much.